Senator Lyons.
Thank you, Mr President. My question is to the Minister representing the Minister for Health, Senator Nash. I refer the Minister to the Prime Minister's pre-election promise that no cuts to health means no cuts to mental health. Given the burden of mental illness in rural and remote Australia, particularly Western Australia, can the Minister guarantee that there will be no cuts to frontline services and coordinated care?
The Minister representing the Minister for Health, Senator Nash.
Thank you very much, Mr President, and I thank the Senator for her question. The government has been very clear that we will honour all our election commitments. We have said that consistently, and we have been very clear in doing so. This government recognises the importance of mental health. Indeed, that's why we have set up the Mental Health Commission. Mr President, it is vitally important for this nation that we get the economy back under control, and we will repair the budget, but we will do so in ways that is entirely consistent with our election commitments. Now, compared to those opposite, Mr President, it is this side of the chamber that will govern responsibly and ensure that we deliver a budget that this nation needs to get it back on track. It might escape—
Order. On my left, Senator Moore's on her feet. Senator Moore.
Mr President, my point of order is on relevance. The Minister has gone through half her time, and the particular question was related to guarantees about cuts to mental health, frontline services and coordinated care.
Order. I believe the Minister is addressing the question. The Minister still has 1 minute and 3 seconds to remain to answer the question. The Minister.
Thank you very much, Mr President. Mr President, the government's vision is for a sustainable health system that delivers quality health outcomes for all Australians, and that includes mental health. Now, the Leader of the Opposition might not like the answer that I'm giving, but I am being very clear in laying out that this government will deliver, and when it comes to mental health, we will be delivering to people across the nation. Those on the other side, it seems to escape them that every taxpayer dollar spent is a dollar that taxpayers have earned, which is why—
Order. Senator Moore. Order. On my left and on my right. On my left and on my right. Senator Moore.
Mr President, again my point of order is on direct relevance. My point of order relates to the specific question asked to the Minister, which is about cuts to frontline services and coordinated care in mental health.
I believe I cannot ask the Minister to answer the question in a particular way or tell the Minister how to answer the question. The Minister still has 23 seconds remaining to address the question. The Minister, there's no point of order.
Thank you very much, Mr President. And, Mr President, in fact, it is this government, not the previous government, that is indeed going to deliver frontline services. It is this minister, this health minister, that has focused very clearly on delivery of frontline services, and that includes the delivery of mental health.
Senator Lyons.
Thank you, Mr President. And I have a supplementary. I refer to the Partners in Recovery program, which provides coordinated clinical support to people with severely disabling persistent mental illness, including in regional areas. I also refer to her answer last Thursday, where she refused to rule out any cuts to funding this important service. Given the Minister has now had a week to read her briefing pack, will she now rule out any cuts to Partners in Recovery in order to provide certainty to the individuals and their families who rely on the program?
Time's expired for asking the question. The Minister. Minister.
Thank you very much, Mr President. And I can reiterate again for the chamber that this government is absolutely committed to the delivery of mental health services right across the nation. Now, Those on this side of the chamber know that it is this government that will do that. The Partners in Recovery program will be assessed in the context of both the National Mental Health Commission and in the review of mental health programs and the review of Medicare locals. Now, we make no apology for delivering good policy outcomes for this nation, and we are going to do that in a sensible, methodical and measured way. We are going to make sure, unlike the previous government, that when it comes to health, we make informed decisions, and that comes also to the delivery of mental health across the nation.
Your time has expired. No, Senator Lyons. When there's silence in the chamber, I will ask you to ask the question. You're entitled to be heard in silence. On my left, Senator Lyons.
Thank you, Mr President. Let's see how we go with this one. Why won't the government release the Commission of Audit until after the Western Australian Senate election? What cuts to rural and regional mental health services is the government hiding?
The Minister.
Thank you very much, Mr President. And there seems to be rather a repetition from questions coming from those opposite. But indeed, I thank the senator for her question.